This meeting, I presented the SYMPATICO study in patients with TP53 mutations. SYMPATICO study is a phase 3 clinical trial that has 3 portions. The first one is safety run-in portion 1, and then the randomized part with 267 patients among many international centers. And the third one was in the frontline treatment. In last ASH 2023, I presented the randomized trial is showing that Ibrutinib Venetoclax compared with has prolonged progression-free survival compared with Ibrutinib plus placebo without Venetoclax. And not only the PFS was statistically significant, but also the OS, there's a trend towards approval with the 2-drug therapy. So at this ASCO meeting, I presented the same trial, but only on the TP53 mutated patients. We have 74 patients altogether, which is considering mantle cell lymphoma rare lymphoma, and the TP53 is only a certain percentage of that rare lymphoma. 74 patients is the largest analysis in the history of mantle cell lymphoma TP53 mutation in the literature. Surprisingly, that with let me tell you a little bit about TP53. TP53 is a guardian gene of the genomes. If it's mutated, then there's many mutations or errors in the replication of the cell that would go undetected to give rise to drug resistance. So it's actually the worst prognostic factor in mantle cell lymphoma. For patients, tens of thousands of patients around the world with mantle cell lymphoma, this is the #1 threat. So we geared onto this topic. We showed that the patients who were treated with Ibrutinib Venetoclax 2 oral drugs has a median PFS of 20 months. This is outstanding times. I mean, other studies show that the PFS was short and the overall survival only 1.5 years. But with the PFS of 20 months in this clinical trial, we further had the overall survival of 47 months. 47 months, as we all know, is approaching 48 months of 4 years. And so this 2-drug combination is really effective. Although they are effective, made a significant contributions to overcome the TP53 improvement, the mutation. However, they are not totally to overcome the whole negative impact of TP53. So those people without the mutations still do better with the PFS, still do better with the overall survival. But in order to eventually overcome the full risk factor, we need not only drugs like 2-drug therapy like this, we need to put more modalities such as immunotherapy, radiation, CAR T-cell therapies. And this is one of the most important progress with the doublet, so the data is very good and encourage the patients with this poor mutation.